My name is Yair, sorry, my subject is the political economy of occupational licensing in the EU. I am a PhD candidate in the Department of Political Science here at the university, and this is one article as part of my PhD articles. And I'm rather, especially comparatively to the other scholars here, I'm a relatively early point of my research, so please feel free to give any suggestions you have or any recommendations before I delve into this project. So, to begin with, what is occupational licensing? Occupational licensing is a state regulation that restricts the practice of an occupation by requiring a license to practice it. I won't go into too many details, but you probably know that in order to be a doctor, you must have a license all over the world. In order to be a lawyer, accountant. You can also think of other occupations such as a taxi driver, barbers in some states around the world, and even bakers. Occupational licensing in the EU, I will give you a quick review of what's the status of this regulation, occupational licensing in the EU. So around 23% of the labor force obtains a license, which means that almost one in a little bit more than every 4 people has a license in order to do his job. It's quite substantial. With regard to the only works, there was researchers showing, I don't have the graph here maybe, but because I didn't thought about it, but you can see that there's a decrease in the trade union in recent years or in the recent decades, but on the other hand you can see an increase in the people that has a license to do their job. There are 800 license, almost 800 license occupations. Not every country has the same amount of licensed workforce. On the right you would see that Germany has the highest numbers with 33% of the labor force, while as in Scandinavia, Denmark has even less than 15%. And in total there are more than 5,500 different licensing regimes, which means that every state has its own licensing regimes. Again, I remind you, it's a national regulation, it's not an EU regulation. Every state determine its own occupational licensing. And you see that also if the same occupation is licensed within different countries, it may be licensed the same. You have here a restrictiveness indicator made by the European Commission for architecture. They did this. They used this index for several occupations, and what you can see here that you have almost all countries in the EU license the occupation of architecture, but some countries license it different than the others. Some, as Lithuania and Austria, the licensing is more restrictive, which means it's more difficult to obtain a license, while again in Denmark and in Sweden it's much easier. You can see here, just quick, it's a map also made by the European Commission. It's an interactive map, but I won't go online and show it to you. That's in the green, it shows the overall regulations by states of the profession of baker. I just randomly chose it out of 800 occupations. In France, Germany, and Central Europe, many countries regulated this occupation, which means in order to be a baker, you have to have the license for that. While in the countries in green, you don't need it to do it at all. You can just go there and become a baker without any preconditions. So, why is it so important for the EU, and why is it such a hot topic in the last few years, or actually since the EU was established? It's because it puts a challenge on the EU single market agenda. Just a quick reminder that the single market refers to the EU as one territory without any internal borders or other regulatory obstacles to the free movement of goods and services. And here there's occupational licensing is of course make it difficult for people to move from state to state because if they acquire the license in a certain place, this license is not necessarily apply in another state, so they can move, and of course the service that they provide cannot move to the other country. The EU already tried to, in order to tackle this obstacle, it tried to harmonize, and it's still trying to harmonize all licensing occupations. What it means, just to make them similar. So the regulations in Baker all across, not only in France and Germany, but also all across the member states would be exactly the same. It's this effort to harmonize OL, you can find it in treaties, as the Treaty of Rome, in legislations and regulation, and some of the regulations really focus on specific occupations, and some of the regulations, like a Directive 2015, the Directive of Professional Qualifications, treat like more holistically the market as a whole, and is applied to all occupations. And the European Court of Justice also have some important verdicts on the issue, but I won't refer them at all in my research. And in recent years, this effort became mostly of the European Commission, more specifically the Directorate General for Internal Market, Industry, Entrepreneurships, and SMEs. And overall, this project of harmonization got a very varied results, from occupations that was only limitedly harmonized, to very few occupations that were fully harmonized, which means that they are regulated the same in all countries, in all member states. It's still in the responsibility of the state to regulate these occupations, but the defaults or the guiding rules for these licensing regimes are determined in the EU level. So it's quite a high level of harmonization. It's almost the highest. I think the highest would be that everything would be regulated in the EU. And these occupations, there are only 6 occupations, only of the health professions. It's doctor, including specialists, general nurses, dental practitioners, veterinary surgeon, midwives, and pharmacists. And another interesting thing about it, that they were regulated, harmonized in the EU level by positive integration, or as I call it, harmonization by restriction. So instead of lowering the level of all the OL regimes, of all the occupational licensing regimes, to a common low ground, what the EU did or tried or promoted is that all the member states would increase the level of regulations of this health occupations to a certain high standard and not to a common low standard. And my research question is, what explains why? How come only in these 6 occupations the EU had made has succeeded in this full harmonizations? And I think that by answering this question, I can also understand the level of harmonization, variance and harmonization in general, and more broadly, I can also explain how regulation in general are harmonized in the level of the EU. I suggest now sort of 2-3 plausible explanations or approaches for this dilemma, and I take it mostly from the literature of regulatory governance. This is what my PhD is about, and I try to explain why these occupations were harmonized. So the first one is the public interest functionalist approach. That's actually the reason that the European Commission, the EU, had harmonized these occupations. That's because they're important, and they wanted to increase their quality, because everybody wants better doctors, better nurses, etc. But also, of course, what they bear in mind is their supply, because if you increase their level too much, and you just won't have enough doctors, nurses, and so on. And I also take I'd like to refer to the more neo-functionalist approach for the EU, is that the market of the health sector, also before all the occupations were harmonized, were already relatively integrated. So for the European Commission, it's much easier, or for the European Union, it's much easier to harmonize or to integrate a market that is already freely integrated by the free market of the EU. A second hypothesis, quite opposite to the public interest, is the public choice or private interest approach. occupational licensing in general, and this was claimed by neoliberal scholars as Milton Friedman and George Stigler, that occupational licensing is actually an instrument by the professions to revoke competition and to limit the competition in their occupation, because if you gotta have a license to get into a certain occupation, then it reduces the number of practitioners that engage with it and consequently increase their wages. In a study made by Comentor and Pagliero in 1 year ago, they got to the conclusion that licensing as a regulation increased the wages of professionals in 5%. So we can conclude by that health profession has a strong lobby, and they could made the regulations there, occupational licensing, just more restrictive, and those are, as we know, these occupations are relatively have a great political power. And just to show you that this lobby is actually occurring, it's not just a theoretically political struggle. I just Googled the organizations, the health organizations that work and associations and lobby groups that works in the level of the EU, and these are only from the dental world. So it's a European Dental Student Association, Council of European Dentists, European Association of Oral Medicine. They are all organizations that work in the EU level to promote the interest of different dental health groups within the EU. And another take on the public choice approach is that not only the professionals, not only it's private interest groups that promote their interest, but you can also think of states, or in this case, the EU. And the EU also has an interest in gaining more control. So he wished, or he made a big effort to harmonize the health occupations in order to increase its control over the health market, which is a relatively large market, and by that way he wanted to be the main regulator of the occupations. Again, it's a matter of control. The EU, as we know, in certain subjects wants more control. I would explain really briefly the methodology I already started, and I'm still in the process of conducting, as I conducted interviews with personnel of the European Commission, mainly Unit E5, which is the unit that engage with professional qualifications and skills, and qualitative analysis of regulation, policy papers, reports, protocols, and all these kind of papers about the subject. So far, again, I suggested a very preliminary explanation, and this explanation is that the EU does aspire to harmonize and usually liberalize all occupations. We know that the EU, when it wants to harmonize, it usually takes a liberalizing approach. It wants to make the market more free, and also in the occupational licensing, it wants to reduce, in general, the burden of occupational licensing, and professionals tend to oppose this harmonization because professionals, as I said, they want the market to be less free and less open, as they want to keep their monopoly and to limit the competition. So they tend to oppose it. By that, we know that the EU would manage to harmonize the occupation if it received the support of professionals, or at least it doesn't face any opposition by the professionals. And here is the interesting thing that what I found out that happened between the EU and the health professions within the EU is that the European Commission made sort of a bargain between the health professions. Health professions agreed to harmonization, and in return they got a more restrictive occupational licensing regime backed by the European Commission. So the European Commission said to them, okay, you would let us harmonize the occupations and make one level of regulations across the European Commission, but we would make it more restrictive, so it would be more difficult to enter this occupation. And again, as opposed to the liberalization, the negative integration the EU usually encourage and promote, it's actually promoted, in this case, positive integration. So the European Commission its liberalizing approach towards the health occupation, and in return for he take control on the occupations, and he promotes integration. So consequently, according to the EU, in certain cases, positive integration is better than no integration, and that's it.
Okay.